Of those 90% who give up on silicone implants, I'll tell you, most of them say, I should have chosen a smaller implant. Good afternoon, everyone.
Good afternoon, everyone. My name is Eduardo Favarin.
I'm June Favarin.
We are experienced plastic surgeons practicing in the beautiful city of Criciúma, and we've been actively practicing for over 18 years now.
So today we're going to talk a little about explant surgery and what exactly is this surgery. Explant surgery is a specialized medical procedure that we meticulously perform when a patient has previously undergone the insertion of a silicone implant and at some subsequent point in her life makes the personal decision that she no longer desires to retain the implant and consequently chooses to have it permanently and completely removed from her body. The name of this procedure is explant, and there are some surgical techniques we use to achieve better aesthetic results for our patients, and that's what we're going to talk a little about today. So I think the first question is, who is the patient that undergoes explant surgery? Who is the typical patient that comes to us to have their implants removed?
There are many patients with diverse and often complex mindsets and various and sometimes deeply rooted complaints who genuinely want to put an end to having dental implants. The first group of patients is very clear, very straightforward, and quite decisive in their intentions. These are the patients who truly no longer desire a foreign object in their bodies. They often believe that the silicone is actively harming their overall health, frequently causing significant discomfort, and undeniably bringing about various debilitating signs and symptoms, such as a persistent lack of vital energy, chronic insomnia, serious illnesses like debilitating thyroid disorders, a frustrating inability to get pregnant, noticeable hair loss, uncomfortable constipation, a disheartening lack of motivation for daily tasks. And indeed, the comprehensive list of these distressing signs and symptoms is truly extensive. Another significant group of patients we are considering here are those individuals who, generally speaking, unfortunately didn't perform well or experienced significant complications with the initial implant procedure. These are patients who, for example, frequently experience significant discomfort, persistent pain, or who, in fact, never truly liked the implant from the very beginning or only found it acceptable for a very brief initial period. Some patients have even told me that they already went home feeling quite uncomfortable and not really liking the sensation or the presence of the implant at all. Maybe there was a wrong indication, for placing this implant. And so these particular patients often want to have their implant completely removed. It's very easy for us when the patient says, I have pain, breast pain, I wake up. I ask, do you wake up at night because of this pain? Yes. So in that case, it's not hard, right, to recommend this surgery or explant. These patients in the future, if they change their minds, can have the implant put back in. And there's a third group of patients who like the implant, didn't have any problems with it, aren't dissatisfied, they don't have any issues with having a foreign object inside them, no problems with silicone. It's just that they're tired of it. They don't want to, in the future, every 10 to 15 years, have to undergo another surgery.
Of course, they've lost the aesthetic result and need to replace the implant and improve the breast, and they decide, I don't want it anymore. So I would divide them into these three groups. The vast majority, I would say 90%, have the explant because they simply don't want the implant anymore. That's the plain truth. They don't have any problems. They don't feel anything. There's nothing wrong with their breasts. They don't have any symptoms, but they don't want the commitment of having to undergo another surgery. They don't want the volume of the silicone anymore. And among those 90% who give up on silicone, I'll say that most of them say, I should have gotten a smaller implant. This week, I saw a patient whom I had consulted, I think, 8 or 10 years ago, and she wanted to get implants. She really wanted implants. And I told her, look, it's not worth it yet. This isn't the right time. If you're going to do it, it has to be a small implant under the muscle. Anyway, a lot has happened since then. And now she came back to see me and said, you were right, doctor. That really wasn't what I wanted. And now she has given up on the implant. So these are just phases of life. These symptoms of silicone illness are very rare. I think that out of all this, we've placed more than 2,000 implants over these 18 years of plastic surgery. And I think I can count on one hand the number of patients who actually had any symptoms that resembled, silicone illness. So it's a safe procedure.
But it does exist, right? Let's not pretend it doesn't exist.
It's a product that lasts a long time, and it's not the main reason for implant removal. The main reason for implant removal is the patient's own choice. Just as one day she decided to get the implant at another point in her life, she decides she doesn't want it anymore, right? So that's another thing as well. We make sure the patient feels completely comfortable. And it's important, right? Since it's a personal choice, we have to make it very clear to the patient that explanting is not the same as getting an implant. When we place an implant, the goal is to make the upper pole more defined, increase breast volume, and achieve a more attractive result. When you explant, it's kind of like we're solving a problem. So the result is whatever we are able to achieve for that patient. And there isn't a standard because each patient comes to us with different breasts, different implant volumes placed in different planes, and with different surgical techniques. So we adapt the explant surgery to each type of breast, to each breast volume that comes to us in the office.
Yes, there is a way to assess this with exams, which is by doing a breast MRI. If the breast with the implant, the result, a breast with the implant is 100%. If the implant represents 70% or more of the breast, this patient is not a good candidate for explant. In other words, her breast has a lot of implant and little glandular tissue. If the patient's breast has less than 70% implant, right, and the amount of glandular tissue is greater, she is a better candidate and will have a more favorable result for the explant. Is explant surgery successful?
Yes, it is.
Or are the patients satisfied?
Look, up until now, I haven't had any patient complain about the result. Maybe that's because we're very selective when recommending explant surgery, and we talk a lot with the patients. Yes, with explant surgery, we're going to shape. Imagine your breast will look like a Sonio de Valsa chocolate. I always make this comparison with the Sonio de Valsa. And we're going to have to remove that filling from inside the Sonio de Valsa. We're going to take out the stuffing. And we'll have to find a way to give shape, right, to what's left inside. And we use a lot of fat grafting, right? So let's suppose it's a patient who has good breast volume, as Eduardo mentioned. She still has some breast tissue left, right? She has a good donor area for us to harvest fat from. And she didn't get a very large implant. She doesn't have, 400 ml, 300 ml of silicone. She has an implant of an okay size. This is a patient who will have an excellent result from the explant. So we really depend on these criteria to be able to talk about the quality of results. But up to now, all of my explant patients have been very happy with the outcome.
Let's talk a little about the technique. Technically speaking, how is the explant performed? The implant is removed, and the capsule that surrounds the implant is also removed. And what is this capsule? It's a fibrous tissue that surrounds the foreign body. It's the body's attempt to isolate the foreign object. So this capsule should also be removed. In fact, the correct procedure is always to send this capsule for biopsy. And if the breast is sagging, we lift the breast, perform a mastopexy, and restore the volume that was lost, the implant plus the capsule, using adipose tissue with fat through fat grafting, which is collected from the patient. And this fat grafting is injected into the gland, beneath the skin, and into the pectoral muscle. So in several layers.
And I would say that this is the big secret of our explant technique, performing this fat graft in multiple layers. And I would say that surprisingly, the layer we use the most for explant is the muscle layer. That's where I would say about 70% of the fat volume goes inside the muscle, right? And that's what maintains the shape of the breast after surgery. All right, let's start answering some questions here. Nice sent in. My friend, as soon as she got silicone implants in her breasts, started having ringing in her ears.
Yes, ringing in the ears is also one of the complaints we study and hear about. It's hard to know if the ringing in the ears was really caused.
It exists.
By the implant, by the surgery, by the anesthesia. If she hadn't gotten the implant, would she still have had the ringing? It's difficult, very difficult. But if this ringing persists, in the end, maybe this patient will try to have the implant removed. Is it guaranteed that if you remove the implant, the ringing will go away? No.
No. So what can I suggest to you, niece? Ask your friend to see an ENT specialist, right, and investigate the ringing. If the doctor rules out any organic cause for the ringing and it still persists, there is a small possibility, but there is one that it could be caused by the implant. We can't say yes or no.
But yes, this is described in the literature, ringing in the ears.
I went to the doctor to have the implant removed, and he said it can't be done because there's only skin and the implant. Is that really how it is? So look, it's not that the implant can't be removed. Maybe he didn't express himself properly. It's just that maybe you won't get such an aesthetic result. It's like Eduardo mentioned at the beginning, you need to have at least a minimum amount of breast tissue. So if you have little breast volume and you want to get an implant, you need to know that your breast will deflate, it will have little volume, and you'll need to have additional surgeries to do new fat grafts because we won't be able to create the desired volume with just one procedure. But it's not an absolute contraindication either. You just need to know what will happen afterwards so you can make an informed decision.
It's like I mentioned about getting an MRI. If more than 70% of your breast is the implant, it gets more complicated. And another detail that needs to be considered is whether you have enough fat, if you have a donor area,
That's right, good point.
because adipose tissue or fat can be precisely placed there during the initial surgical procedure, and it can also be subsequently added later in multiple distinct sessions, more than just once.
So here in Brazil, we use a lot. In the Americas, right? South America, Latin America, North America, we use implants a lot. But in Asia, they don't like implants. So there, the majority of breast augmentations are done with fat. And usually to achieve these fat augmentations, 2 to 3 surgical sessions are performed, right? With fat placement at intervals of about 6 months. So these are also things that the patient needs to be aware of. It's kind of like a breast reconstruction, but without an implant, okay? But yes, it can be done. You just need to have a donor area. I would say that the most important thing isn't how much breast tissue you have, but how much fat you have to donate to yourself. That's the main limiting factor.
Is explantation permanent?
No, if the patient wants to put them in, if in a year or 2 she had them removed, then she changed her mind and had them put back in. If in a year or 2 she changes her mind about the explant, she can get the implant again.
If she didn't like the result,
She can. Actually, very few things are permanent, right?
thankfully.
Thankfully. What is the recovery time for silicone breast explant and for lifting sagging breasts?
3 weeks, right? 3 weeks before you can drive, sleep on your side, so about 21 days. For the first 15 days, it's best to take it easy and stay at home. You should walk and stay active, but avoid moving your arms too much, doing housework or cooking. No. During those 15 days, you really need to, your husband, your children, your mother, or your sister will have to help you. You'll be like the Queen of England. You won't do anything. After 15 days, you can do light chores at home, and in 3 weeks, you can go back to work.